Ladies and gentlemen of the Bailiwick, welcome. Welcome to the most recent COVID briefing. Now, this one today is probably going to be shorter than normal, but we'll wait and see. The reason for that is that our lockdown rules, which have been in force since we commenced lockdown on the 23rd of January, still remain in force in the same form and the same vigour as was then. But, and it's a big but, tomorrow lunchtime, the Civil Contingency Authority meets again. We will review all the advice and all the figures that we have at that time, and we will decide whether we're going to make changes, if any, and if we are, over what time frame, and those will be announced at the briefing on Wednesday. So today, you still have two stars. You've got Dr. Brink and Dr. Raby. They're here. Dr. Brink will give you a general update. She'll also tell you what she thinks from her considerable experience, the position we're at in relation to the lockdown. And Dr. Raby will deal with many factors, but he'll deal particularly with the care home situation and also with the figures in the hospitals and how they may vary over the next few days. Because this horrible virus is cyclical in the sense it has a time period. Now, the lockdown is working, but it will only work if people continue to be vigilant. This beast will not go away. It's looking there to cause harm to our community. So we all, every one of us in the Bailiwick, have to be vigilant. We have to maintain social distancing. We must stay at home whenever we can. We should only go out for our exercise and our activity. We should always, when we go out, wear masks, maintain social distancing, respect hygiene. We must continue to do that. Otherwise, this lockdown, which we hope will be shorter than the previous one, will turn out not to be so. The numbers are still high, but they're going in the right direction. Now, that does not mean that every single day the figures will go down, because it depends. There can be spikes, etc., etc. But the general trend is that this is coming more under control, and the figures are looking, as I say, optimistic. Again, I make no apology for emphasising again that we must, in our situation, continue to be vigilant. And that will also happen post-lockdown, because this virus is going to be around for a very long time. The vaccination programme is working very well, continues to function well. So, again, just emphasising, if you have any symptoms, please stay at home. Please do not go out at all. Contact your GP or the helpline. Now, also, we do still not know the precise cause or causes of this recent outbreak. Now, I've had people say to me, oh, you're trying to hide something. We are trying to hide absolutely nothing. We're giving good news as well as bad news, but we're quite prepared to give bad news. What we are saying is that the cause may be people not complying with travel restrictions or self-isolation rules, but equally it could be accidental. Somebody looking after somebody who is in isolation touches some cutlery or does something quite accidental, and then the virus is spread. We simply do not know. So please do not speculate. Nobody's seeking to protect anybody. Nobody's seeking to hide anything. Now, just a few other things before I hand over to Dr. Brink. There's been a little confusion in relation to what you can do when you go out, or how you can exercise your 2 hours activity, your 2 hours out of the house. You can obviously go out with members of your own household. You can also go out with a person, one member of another household. But again, to emphasize that word must, you must socially distance. You should wear a mask. You should exercise high degrees of hygiene. Wash your hands when you go out, wash your hands when you come back in. Always socially distance. The only exception to that rule is that if you are a single parent with a family, you can exercise your activity with one other person from another household. But again, social distancing, you must wear your masks, and that doesn't mean you can have two households. That doesn't mean you can have a mum and 3 children and a dad and 2 children from another household. That is not permissible. Now, you're going to hear from Dr. Brink in due course, as I say, and Dr. Raby about the medical aspects, but I'd just like to say this. I'd like to say this not just as chair of the Civil Contingency Authority, but as a citizen of this magnificent bailiwick. We see Dr. Brink. We're grateful for her efforts over the last 10, 11 months, but she's got a staff following her who are equally important, have worked so diligently. So is Dr. Raby. He and his colleagues at the hospital they've done service beyond the call of man and woman, really. We've got civil servants and communications officers who've worked long, long, long hours. I've only been involved in this since I became Chief Minister 4 months ago. Civil servants have been involved in it for much, much longer, and they work, frankly, much harder than I do in connection with all of this. We've also got our emergency services, we've got our health workers, we've got our care workers, we've got everybody in the community who's done so much. From me, I thank you. If I don't mention it, I also mention our teachers. If I don't mention anybody, that's by omission, because I am very grateful. You're in our thoughts. Thank you very much for all you do. Now, as I say, Friday, there was announcements about care homes, etc. We'll come to that in due course. But at the moment, I think enough from me. Dr. Brink, you take it forward, please.
Thank you very much, Deputy Fairbrushe. And I'm going to go to the COVID slides now. And the first slide is entitled COVID-19 Case Summary. And this slide then gives you a case summary of what our current situation is. So instead of showing you what happened in the first wave and between the first and second wave, I'm not just focusing on what's happening now because you had all that previous information. So we've had a total of 431 positive cases since the 22nd of January. And of those, I'm pleased to say 65 of those have now recovered. And we're very pleased that we haven't had any deaths. But it obviously is early days and we still need to be really cautious. And we've got 366 active cases. So breaking news on this and information that I've literally got in 5 minutes ago is that we sent off the first 4 cases that we received on the 22nd of January. We sent them off for genetic typing, and all 4 of them are the UK variant of the virus. So all 4 of them are the B117 UK variant, so the one that was initially described in Kent. Now, this actually fits in with our understanding of what's happened to us because we felt that we were seeing extremely rapid spread of the virus in a way that we simply didn't see in the first wave. So we suspected it was caused by a variant, and indeed that is now confirmed. So I think that's important information, helps us understand as we move forward. So if we go on to slide 2, which is entitled Cases since the 25th of January, I want to draw your attention to some of the important parts of this slide. So if you look from the 28th of January till the 2nd of February, what you're seeing is a peak of cases, 35, 44, 47, and so on. And Dr. Raby will explain to you the significance of the peak that was seen on those dates. But if we then move on and we go on to the next slide, which is entitled slide 3, and we look on how this is translated as we've moved on, we've seen some decreases in the number of cases. And looking as we go on to Friday, to the 27th, 28th, what I wanted to emphasize there also was the number of contacts that we've had versus unknown community cases. So again, if you look on the 27th, 28th, and 29th, on those days, you can see on the 27th we had 6 unknown community sources and 17 contacts, and then on the 28th we had 23 contacts, 12 unknown community sources, and again on the 29th 27 contacts and 16 unknown community sources. Now this data is really important because, as I've always said, what we need to focus on are those cases of unknown community transmission, because those are the ones that we can't explain their links, and those are the ones of concern for us. Contacts we know about, we've identified them as people of interest, they're usually in self-isolation, so really important. So if we then go on to slide 4 and we look at the evolution of what's happened from Sunday the 30th until Sunday the 7th of February. And what you can see is you have a decrease in the number of unknown community sources. If you look at Friday the 5th, you've had 1 unknown community source. Saturday the 6th, we've had 2 unknown community sources, and Sunday the 7th, we've had 2 unknown community sources. Now, also what's important as we move forward and over the weekend, although we had some cases that were classified as unknown community sources, of the 5 last cases, there was only 1 that we genuinely couldn't link to anyone or any source. What we did manage to do with the other 4 cases is, although we couldn't directly link them to another person, they occurred in areas of interest for us, so sources that we knew we'd seen previous cases in. So we're likely the source of their infection. So there was 1 case of concern, but the other 4 we think were probably linked to existing cases that we were already aware of, and indeed we'd already started putting mitigations in those areas. So I think that's really important that we understand exactly what these figures mean to us. I think we also need to take note of the fact that we're introducing a lot of surveillance testing at the East Arm. So I think you're all aware of that. And within that surveillance testing, as part of our back to school, we've been testing teachers and as well as students. And 2 teachers tested positive in that testing program. So it really just shows how these surveillance programs are working and how necessary they are as we move forward to keep our communities safe. So really important facts, those. So if we go on to the next slide, and we can see the next slide is entitled Slide 5, and this specifically gives you information on the care and residential homes. Now, I'm very pleased to say within Care Home 1, so you will be aware that those individuals were transported up to the hospital to provide further care. We've seen no further cases, so we remain on 2 positive cases in residents and 2 positive cases in staff members. So that remains on 4. So on Friday and into the weekend, we identified a second case in a care home. And I think what's really important to focus here, these are the systems working again. This is a person who had some symptoms, they were really mild, came forward for testing. We tested them, found that they were positive. They worked in a specific care home, and we immediately then tested all of the residents and the staff within that care home, and we found no positives at all. And I think it's important as we move forward that people come forward, get tested, and we're able to investigate appropriately. And I have to say we're enormously grateful to the staff of St John's for working so closely with us and working together to test all of the staff and residents of the care home. By doing this, we'll ensure that we provide as much safety as we can as we move forward. So again, I think this is a testament to the expanding testing capacity, but also to the community and joint working that we're doing. So important as we move forward out of this wave. So if we go to the next slide, which is entitled Slide 6, which is active case by type, what you will see from there is the orange line there shows the unknown community source, and the green line shows the contacts of known cases. And what you can see in both of those situations, you'll see the number of cases easing off. Now, what we will see as we move out is we'll see some variability. So, for example, yesterday we appeared to have more cases, but those were linked to families, and we know particularly this variant spreads very rapidly within families. So we can suddenly get a batch of 4 to 5 positive cases, but they exist within a particular family. So what we will see in days to come, we'll see some bouncing of the numbers, probably mostly identified related to us identifying groups of individuals, but overall a promising trend. And I don't want to preempt issues, but as of today, as of 1 o'clock today, we'd had no new positives today. Now, obviously the day is young, we might see positives as they go on, but it's the first time since the 22nd that we've had no new positives by 1 o'clock. So promising move in the right direction. So the final slide, which is entitled Slide 7, which shows the age profile of cases. And what you can see is that we're seeing most of the cases in the 41 to 70 age group. So you can see the bulge of infected people in that age group. And this is important that we look at the age demographics specifically of active cases. So these are people that are still active with COVID-19, because it enables us to look and plan the healthcare services, not only with Dr. Raby in secondary care, but also with our primary care colleagues. And our primary care colleagues have been working really closely with us, and we appreciate their support. So I want to conclude by saying one final thing about masks. Now, I know there's been some confusion about when people should and shouldn't wear masks with exercising. And again, what we're looking at is masks are strongly recommended. So we're looking at people wearing masks when they are around other people. So it's that common sense approach. If you're in the vicinity of other people, you need to wear a mask. But if you are running by yourself on the cliffs with no one else around, no, you don't have to wear a mask. So I think it's that really common sense approach. Is, am I in the vicinity of someone else? If not, then that's all right. But if you are in the vicinity of someone else, you have the risk of passing the virus between two people, and it's really important that you then wear a mask. So I think it's using that that general approach of social distancing to inform how we act. So I think that's something we must take into account as we move forward. So thank you very much, Deputy Fairbrash. That's my update.
Thank you very much, Dr. Brink. That's very helpful. Dr. Raby.
Good afternoon. I'm going to cover three areas today. One is just to update you on the hospital position. Secondly, I want to just mention the residents of a care home that we took into the hospital site on Friday. And thirdly, just to mention an area of potential treatment that some of you are asking about, and we thought we should just mention since several of you are interested in that. So in the hospital at the moment, we still have 10 patients in hospital with COVID-19. We discharged one patient and we've admitted another. Of those 10, 2 are receiving intensive care level support, critical care level support. And we have 8 in the Brock ward, 2 of whom were the positive patients we brought in from the care home on Friday, not because they were sick, but because we needed somewhere to keep them while there were staffing issues at that care home. They remain well. And so a total of 10 patients in hospital. The 2 intensive care patients, we're cohorting them into an area on Brock ward where we have good ventilation and good facilities for that. And so our intensive care will be split between 2 different sites in the hospital at the moment, the normal intensive care unit and an area on Brock ward. We're ready to open the patient unit as an overflow intensive care if we need to. It's all ready to go, and we're making preparations to do that if we have to. But at the moment, we're managing perfectly well in the way I've just described. In the hospital, we're quite prepared for a busy week, and the reason is that the numbers coming to hospital tend to lag a bit behind being identified as positive. And so we have 10 at the moment. It won't surprise us if we see a few more coming in during the week, because there's often a lag between testing positive and needing hospital care. Similarly, some patients who need hospital care develop a need for intensive care later. So again, it won't surprise us if we need further patients needing higher levels of support. And we're ready for that. And we're in a good place to provide all of that. So just to reassure you, we're in a good place for looking after anybody in the island with COVID symptoms, with COVID disease. It does impact on the amount of planned work that we can do, and we're doing as much as we can. But that's the update for the hospital. Now, on Friday, we took 11 residents from a care home at Le Grand Land. And that was not because they were sick and needing intensive care or hospital treatment or even needed to be on this site at all. But the issue was, you might remember, that there were a number of contacts at that care home, which made it difficult to staff it over the next couple of weeks. And we've taken them into the hospital site. Now, those 11 patients are here being looked after. The 2 of them that were positive for COVID are in the Brock ward, and that's just because that's where we look after them. They're doing fine. They're not sick. Similarly, the 9 patients who tested negative but we brought onto the site were all retested at the weekend. And as Dr. Brinks just said, they continue to test negative. We'll keep a close eye on them all. But again, they're all well. So they're all being looked after. And that's just how we're managing that position to help the position in the care home. Finally, from me, I want to. So some of you have been asking about. Well, we get a lot of asks about a lot of different treatments, but several of you are asking about a particular treatment called ivermectin, which must be bubbling out there. We have a medical cell that keeps current treatments under review all the time, and this is certainly one of the drugs that we're keeping a close eye on, because there's a range of studies coming out about ivermectin, some of them showing benefits, some of them showing harm, and some of them not showing anything at all. But as often is the case, there isn't enough evidence yet to say as a consensus view that we should be using this drug. So at the moment, we're waiting for further trials and further support. It's not currently recommended for use by either NICE, the National Institute for Care and Health Excellence, or from the American equivalent. And so we're keeping a close eye on ivermectin, but the evidence isn't quite there for us to be using that at the moment. That's all from me. Back to you, Deputy Brewer. I'm so sorry, Deputy Fairbrush.
Well, we look very similar, I think. Thank you very much. He's resting for Wednesday, because Wednesday we intend to have our full panel where we'll be talking about what decisions CCA will have then made the day before. So Deputy Berard will be a valued member of that team. But now, media, it's up to you to ask your questions. And if you do it in their usual way. Ewan Duncan, I see you've got your hand up. Ewan.
Good afternoon, panel. Dr. Brink, a question for you. There's new evidence coming out that the AstraZeneca vaccine isn't very effective against the South African variant. It's obviously causing some concern to the population who have already been vaccinated. Is there any intention to update what we're doing here in regards to that?
So thank you. That's a really good question. So there's some early evidence coming out. They're quite small studies and they've yet to be peer reviewed on it's the B351 variant that's been described in South Africa. So we'll keep it under review, but actually they look specifically at mild disease there. And if you look at the aim of our program is to prevent COVID morbidity and mortality. So it's that severe disease and death that we're trying to prevent from the vaccination program. So I would still strongly encourage everyone to get the vaccine. I think that's really important. And of course, we will review the evidence as it comes out. Now, I think what I think is important is that it is an RNA virus. It is going to vary. So it might be, if we eventually end up with a 2-yearly, 1-yearly, whatever boosting program, we just don't know at this stage, but it might be that the vaccine's tweaked on a year-by-year basis, really similar to what they do with the flu vaccine.
Thank you. Hamish, I think you've got a question.
Hi there, good afternoon. Yeah, just to ask whether or not achieving 0 cases to get rid of the virus from here enough to us to go back to some kind of normality, is that still the aim given the vaccination programme, and is that still achievable?
Let me say politically, we hope it is. We'll be discussing matters on Tuesday. Now, that's not going to be the panacea of all, because this will develop. It is still a developing situation. But the intent, but only if it's safe and sound, is to move out of this lockdown as quickly as possible. I don't know if Dr. Brink, do you want to add anything?
Yeah, I think it's really important that we don't have a fully vaccinated population yet, particularly our at-risk groups. So you're looking at always balancing the risk. So the idea is to try and get rid of the virus from the population while we immunize our population and learn more about how things are going to move forward.
Thank you. I think we'll move now to Jim Delbridge of Island FM. Jim.
Thank you, panel. Quick question really about children and staff being tested ahead of the partial reopening of school settings, which started today. My question really is, were any positive cases picked up, and will this data and that of the regular retesting be published?
Dr. Brink?
Yeah, so I think I did mention it in my summary, is that yes, we picked up 2 members of staff as part of the testing program, and that was not surprising to us. It's part of the surveillance program. It's why we're doing it, and yes, there will be regular retesting, and yes, we intend to make these results known. We feel that we're working together as a community, and so the community needs to know what's going on and be kept fully informed.
Thank you. Juliet Puto.
Yes, this is Juliet from the Guernsey Press. I don't know if you've got a chance to see our website, and I think also our colleagues in the Jersey Evening Post website this morning, but a Jersey minister is suggesting that obviously now Guernsey is no longer completely COVID-free, once the current outbreak is more under control, there might be an option to have a travel corridor with Jersey. Is this something that we might be looking at?
In due course. At the moment, it's far too early. We've still got 366 current cases. That number will drop as Dr. Brink and Dr. Raby have explained how it works. But as soon as is practicable and is safe, and I emphasise both those words, we'll be looking for opportunities for people to travel. I think I've missed you, Matthew Leach. I don't think you've had your chance to put your first question yet. And I know you'll have at least one question, Matthew. Yeah, well, if Matthews isn't there, we'll go somewhere else. I think he normally has a question to ask.
Hello, can you hear me?
We can, Matthew, yes.
We can. I do have a question. Good afternoon, everybody. We've been talking to a lot of people, including some essential workers, who don't feel protected by employment laws in Guernsey. People who feel they should be self-isolating or shielding perhaps, but are facing docked wages or in some cases the loss of their jobs, especially when facing forced self-isolation with employers who simply won't pay for this time off. What support or protection is available for people who feel they are being faced with some very difficult decisions?
Yeah, well, let me deal with that both as a politician and as now a part-time lawyer. Well, yesterday's lawyer, really. But in relation to the political thing, we're saying to everybody, the paramount consideration, overwhelming and overarching of anything, is safety. You must not go to work if you're feeling ill, if you've got any symptoms at all. You just must not work because that's not going to do you any good. It's not going to do your employer any good. If they have concerns, they should contact those at Employment Relations in Guernsey with details. They can be treated anonymously if that helps the employee. Most employers are acting reasonably. There are bound to be one or two that will not be, because that happens in every situation. There is employment protection law in Guernsey. It's been in place now for over 20 years, and that should, dependent on the individual circumstances of the individual employee, help them. But as I say, I just emphasise again, Matthew, and to everybody listening out there, the overwhelming consideration above all else is the protection of the community. So don't feel pressured by your employer to work in circumstances where you clearly should not. Who have I got? I'll go back to Ewan Dockin. Ewan.
A question for you, Deputy Fairbrush. Just picking up Juliet's point about working with Jersey. I know you've just answered that, but obviously this summer, potentially, the islands could both be in a very different place to we were last summer. And of course, with the vaccinations taking place in both islands and really mirroring what each other are doing, you know, the same sort of groups are being vaccinated at almost the same time. So I know you said that it's not a conversation for now, but I'm sure there'll be many people listening from the hospitality industries who are hoping that we can open up the borders just a little bit more, because realistically, Guernsey hospitality can't survive on the rest of the bailiwick, unlike the rest of the bailiwick surviving on Guernsey.
That's a very good point. I agree with you absolutely, completely. And I wasn't trying to say, and I know you weren't saying I wasn't trying to say, well, that's it, no opening at all for months and months and months. Of course, we want to work with our colleagues in Jersey. Of course, we want to work with our colleagues in the Isle of Man as well. And I'll be speaking to their chief minister, in fact, at 2:30 today in one of our regular updates. And I'll also have a chance to speak in a different forum to the chief minister of Jersey at 5 o'clock today. But we want to open up as quickly as we can. The hospitality sector in particular, it's not the only one, has received a real bashing over the last 8 or 9 or 10 months. And we want to do all that we can to realistically help it. But again, I just emphasise we need to be safe, because there's no point opening up the borders prematurely and all of a sudden we're going to have another lockdown in 6 weeks' time or 8 weeks' time or whatever it may be. But it's a very good question. Thank you for asking it. Just going again, I'm not going to go in the same order. I'm going to try and vary things to make it more interesting, albeit all the questions are always interesting, of course. Matthew Leach. Matthew, you've got another question. Hello, Matthew.
A question for Dr. Brink. If a person is immunocompromised, can they safely be vaccinated? And if not, are there any alternatives to protect these people?
Yes, they can be safely vaccinated. It's not a live vaccine, so they can be safely vaccinated. And we'd, in fact, if you look at the clinically extremely vulnerable group, which are group 4B, they are people who have cancer, on treatment, organ transplants, and so on. So, those fall into the immunisation category. So yes, they can be safely vaccinated.
Jim Delbridge.
Yes, thank you. A question for Dr. Brink. Is it known how long the vaccines immunise you against the virus? How long? 3 months, 6 months, 12 months? And if you've vaccinated everybody...
That's the $1 million question. So I think it's a really good question, and it's something, the duration of immunity following vaccination, we simply don't have that data. So we're not sure whether we'll have to boost people a year, every second year. That data will become apparent. We're also not sure whether the virus will mutate, so that we'll have to tweak the vaccine slightly if you give a booster dose. So that's the big unknown at the moment, and we won't really get that data until we've had people sort of 6, 8, 10 months down a year post-vaccination. They will be able to analyse that data. But what they're doing is they're looking, for example, at the rates of antibody decline and so on to give us some idea on the levels of protection. But the data's just not there yet.
Juliet Puto, your next question, please. Hello, Juliet.
Yes.
Yep.
No, sorry for the delay there for a moment. We've had someone get in touch with us who had heard, I'm afraid it's always risky with rumours in Guernsey, but they'd heard that firefighters had been vaccinated, but police staff hadn't. I was just wanting to check if this was correct, and if possibly what was the thinking behind it.
I can't comment on individual groups. So the people that have been vaccinated are people who have, if they're health and care workers, if they have providing direct hands-on care. So I think, and that's how the groups have been determined. So I wouldn't like to comment on individual groups.
Thank you. Hamish, your question, please.
Thank you. Yes, to Dr. Brink, I understand you sent the samples as quickly as we possibly could after this latest outbreak came to the UK for these genetic sequencing tests, but it's taken 2 and a bit weeks for these results to come back to tell us which variant we're working with here. Given that mutations and variants are becoming increasingly important with regards to fighting this virus worldwide, how worried are you that we're in such a reliant position on the UK providing these results to us?
So the provision of results and identification of these viruses as a variant has not changed our clinical management, so in our public health management. So the important thing is that it's of note to detect the variants, and it does help inform our policies and so on. However, our management of this wave was absolutely the same. It's the bringing in of the non-pharmaceutical interventions, so the NPIs, and that is key. So if anything, you'll enhance NPIs, but how this virus behaved from Friday the 22nd, we were highly suspicious that this was a variant, and we acted with speed because we were convinced that this was a variant. So the knowledge of exactly what the variant is, of course, is important to inform the public health response, but not on an immediate basis. The immediate basis is you don't wait for that sequencing, you respond immediately. So when we detected that on the night of the Friday the 22nd, the advice was this was unusual, 4 cases, apparently unrelated. The evidence suggests that this is the variant, so we need to respond immediately. So we didn't want to wait for sequencing data because of that.
Thank you. Matthew Leach, please.
A question for Dr. Brink. Before, eventually, when all the schools head back, are there any plans to vaccinate teachers and staff before this?
So we're vaccinating in accordance with the JCVI protocols, and if those change, we would of course modify, but we are following the JCVI protocols because that is the risk and evidence-based approach that has been used to date. But any changes, we would of course modify that if JCVI change their priority groups.
Thank you. Juliet Puto, your next question.
Can I please check, are you able to name the second care home that we've had the positive case in?
Dr. Raby? So perhaps ask Dr. Raby.
And just to clarify, the case was a worker who had attended the care home, who very rightly and correctly wore PPE and came forward for testing, and we're grateful for that. And the case is being really well managed. It was St John.
Yeah, and Dr. Brink dealt with that in her initial remarks. We emphasised there are no cases with patients. It was the worker that's been described by Drs. Raby and Brink, and that has been extremely well managed by, as you would expect, from the high quality of St John's residential home. So nobody needs to worry in that regard. Hamish and then Ewan. Hamish? Yeah, Hamish, please hand up.
Sorry, the question was about the first care home. Is there any more information about how the positive cases originally found themselves into that care home, and what lessons can be learned from that? Dr.
Raby, is there anything you could add before I come to Dr.
No, I don't think so. The first positive we identified was in a worker at the home who was picked up through surveillance testing, basically. And no, I don't think that we've got anything further nailed down on that, unless Dr. Brink's heard more this morning.
Let's ask her.
Yeah, so the case was identified through the contact tracing process, and so it's all the systems working. So the moment we identified a case through our contact tracing process, we immediately threw the net wider and tested around that case. So these are all the contact tracing processes that work so well for us now and worked so well for us in the first wave. So it's those processes that enabled us to detect it early and respond to it early.
Thank you. Ewan Duncan.
Question for Dr. Brink. I know we spoke on Friday's press conference when we had 0 community cases. I know that we've picked up a handful over the weekend, but from the data and where you're sitting, how much confidence does this give you moving forward? And as you say, no cases today so far.
I'm optimistic, and as I say, even if you look at our last cluster that we called unexplained community cases, 4 of those we've got suspicions of links to sources. We just can't quite find that immediate link to a specific contact, but they certainly are linked to areas that we know that we've had COVID activity. So I am optimistic. I mean, the contact tracing team are working well, the testing team are working well, we're getting the results through, and we are moving in the right direction. But we can't be complacent because this could flare up. It's likely that the other cases are also the variant. And in fact, we've sent a selection of further samples for sequencing as well, so that we can show whether it's the same virus as we've moved on through the week. So we've selected out from various days and sent samples off. So we can't be complacent because we know this virus is highly infectious, but we are moving in the right direction.
Thank you. Ireland FM and Jim Delbridge.
Thank you, panel. I fully realise you don't have a crystal ball, but just a question really regarding travel. Are vaccine certificates going to be handed out, and do you think they will be necessary for travel purposes as proof that you've had vaccinations in the future? And will certain jurisdictions only allow you to travel there if you've had a certain vaccination?
Well, I'll deal with the political bits. I believe certain jurisdictions will say that. We're looking into it. We're seeing what we can do because, again, when lockdown permits, we want people to be able to travel. And there's no point travelling to somewhere if you haven't got the relevant piece of paper because they won't let you travel. So I want to do that. I don't know. Does Dr. Raby or Dr. Brink want to add anything? They don't necessarily have to. No, they're both shaking their head. So no. OK, thanks. We'll go on to the next question then. And that will be from the representative of the Guernsey Press, Juliet Puto.
Yes, panel. Obviously, we've got some young people back in schools today. Obviously, life's going to be very different for them. You mentioned that obviously during the preschool testing, you've had 2 teachers come up positive. Also, I think on Friday it was estimated around 300 students were also going back into school. Did we see any positives among those students before they went back? And also, do we know how schools are going today? Do we know if it's going well?
Well, I don't know, Dr. Brink. We've not heard anything. I imagine we would hear if they were going badly. So keep our fingers crossed. I think it is going well. But Dr. Brink?
No students were tested positive.
Thank you. So who are we on to now? Hamish, I think you've got a question. Yes.
Yes, one more question for Dr. Brink. Now that the testing capacity we have here is higher than it was, and that the number of known contacts of cases, for example, is going down, so fewer people requiring testing when they're symptomatic, is there any sense about a movement towards more asymptomatic testing to give a better idea of, or certainly a better warning system if a further outbreak comes back?
Dr.
Yes.
Brink?
Absolutely. So we're looking at ramping up the surveillance testing to include numbers of groups of individuals, not only health and care workers, but some people working in retail sector, care and residential home staff. So we're looking at a blanket of surveillance testing. So you're absolutely right. As those numbers go down into surveillance testing, and we're already mapping that out.
Again, Guernsey Press, Juliette Puto, and then you and Duncan after.
Just following on from that, do we have a breakdown currently of how many symptomatic versus asymptomatic cases we're seeing in Guernsey?
So the majority of cases, even if we've identified them through surveillance, have actually a couple of days later become symptomatic. So what we want to do is go back and have a look at this in more detail, because our feeling is clinically, as we phone these results out, even if it's a contact and they're surprised, when we do their welfare checks further down the week, they actually develop symptoms. So we need to have a look at that in more detail. But we'd say the majority of people are symptomatic, which is what we'd expect, but we don't always identify them when they're symptomatic. And I think the concern we have is in the early stages, what people are doing is just feeling slightly off, slightly achy and painy, a bit tired, and they're only sort of developing more obvious symptoms a day or so later. So it's that early recognition of those subtle symptoms that'll be so helpful for us.
Thank you. You and Duncan.
A question for Dr. Raby. I suppose two parts to this question. The first part is that those that are in hospital from the first care home, how closely are they being monitored for any potential symptoms that may come? And the second part of the question is, I remember the last lockdown and with the unfortunate cases we had in care homes, it was spread by staff working on multiple sites. Is that still happening now, and has the policy on that changed?
Dr. Raby?
Firstly, the patients we've taken from that care home are being closely observed. If they develop any symptoms, we'll catch them. I know that one of them's got a cough, but he's negative, and it's a sort of long-standing cough. So we know about that sort of thing, and they're under close observation, and they'll be tested regularly. So if they turn positive, we'll find out very quickly as well. They're all being managed in a way that means that they won't be a risk to others if they do become positive, because they're all identified as close contacts. So they have to be managed in that way. Like everywhere else, we've learned a lot from the first wave in terms of care home protection and the way care homes work, and our care home cell have been absolutely on top of this. And we're seeing this time, I hope you're picking up, that the care homes are managing these things ever so well. So no, there aren't staff going in and out of multiple care homes. When this outbreak happened, care homes were ever so quick to stop footfall coming into the care home that didn't need to be there. So the care homes are protecting themselves, protecting their residents exactly as we'd hope. We've got the vaccination program in place, and most, the vaccination rates at St. John's, for example, are really high, which is really good, and that helps protect residents and staff. And we've got loads of PPE. Things are being done absolutely as we'd hope. So lots of lessons learned and lots of progress, and that's because in the first wave, it wasn't, we weren't alone in the first wave in having care homes as a front line. That's how it was around the world, basically, bit by bit.
Thank you, Dr. Raby. Julia, I see you've got another question.
I do. Sorry, panel, to put so many to you, but lots of interesting things going on. Obviously, things have changed quite dramatically for people recently with mask wearing and social distancing. Once we do come out of lockdown, are we looking to maybe keep some of those measures just in case it does get back into our community, such as maybe mask wearing in shops? Is that something we're looking at?
We're looking at all those things. You are exactly right. We haven't made any decisions yet, but those are things which would seem to me, speaking for myself, as entirely sensible as we come out of lockdown and once we're out of lockdown. I don't know if anybody else, unless Dr. Brink or Dr. Raby want to add anything, I'll pass on to the next question. No, they don't. So they're happy with my answer, which relieves me greatly. Matthew Leach, you haven't asked a question for a time, so I'll give you the opportunity.
You've mentioned a number of times that you can't comment on groups being vaccinated, but we've heard a lot of concern from essential workers on the order of essential workers being vaccinated. Is a schedule publicly available?
Dr. Brink.
I'm not sure what the concerns are, because we're talking about health and care workers that form part of Tier 2 of the vaccination programme. So I'm not aware of concerns to that. So I'd be very interested if there are concerns in relation to that.
Thank you. Hamish, your question, please.
One thing I saw this week is some concern that if we did get quite a lot of snow and ice over the coming days, there may be reluctance for some people to leave their homes to get tested. Yeah. Is there concern about that, and is there plans being put in place to ensure that people can continue to move around the bailiwick?
Dr. Brink?
Well, I think with regard to being tested, if people can't leave their homes, I would suggest that they discuss it with their GP, because the GPs can, of course, see people in their homes, and I think that would be the most appropriate thing to do. I think we couldn't send out all the people doing the sampling to the various homes around the island. We simply just don't have the capacity to do that. That wouldn't be possible. So I would say to people, if they are worried, they're housebound, they can't get out of their house, and they feel unwell, then to discuss it with their GP. I think that would be the most sensible thing to do.
Let's just say, Dr. Brink, on that point, we get inches and inches of snow and it's not possible. Would it be possible then, when the snow eases and people can travel more easily, to, for example, open the Bow facility for another day?
Oh, for the vaccination, people can't get to the vaccination program. Absolutely, yeah. No, sorry, I thought they were talking about the testing, not the vaccination. The vaccination would just shift the days of vaccination, so that's no problem at all. Sorry, I was focusing on requesting testing rather than vaccination. The vaccination will just reschedule. Okay,
thanks. And I was just building on the previous question. Who have I missed? JP, which means Juliette Puto of the Guernsey Press.
Yes, obviously, hopefully, as things have gone well with testing of getting some students back to school, how are talks going about possibly getting more students back into school so parents possibly can remote work a bit more effectively without having to homeschool?
Well, I mean, that's a wider question that we will discuss both with our medical experts politically, and with particularly, of course, with our colleagues at Education, Sport and Culture. I would have thought it's a little time off yet without being discouraging, because we just want to make sure that this virus is well controlled before we open the doors too wide, because it'd be much more difficult to close them again. So we just want to do that. But of course, the wish is to get children back to school for everybody's benefit, for the children's benefit, parents' benefit, teachers' benefit, as soon as it's practicable and is safe. Hamish Askery.
Sorry, one final question for Dr. Brink. I wonder if she has the data on the percentage take-up of vaccination for people in care homes, for example. There has been problem elsewhere in the UK of people refusing to have a vaccination or choosing against it. And although it is voluntary, clearly you want as high a percentage as possible. So is there data on that we can have?
Yeah. So the vaccine uptake has exceeded our expectations. So we modelled on an 80% uptake. In all of the places, we're looking at way in excess of 90% uptake. So we've got a very high vaccine uptake, which has been extremely encouraging. So we're going to do some precise modelling on exactly what the uptake is. But in most of the care homes, you perhaps have one or two residents that haven't been vaccinated, but in a lot of them, the entire home has been vaccinated. So we've had an enormously positive uptake. People have engaged with the programme. The care and residential staff have also engaged with the programme, and we're enormously grateful for that support.
Thank you. I don't see anybody. Well, Hamish, you still got your hand up, but I imagine that's an old question. I don't see any more questions. So I thank, again, the media for their very perceptive and detailed questions, responsibly asked, and I thank you very much for that. And it's important that these questions are asked. I thank Drs. Raby and Brink, again, for their considerable professional expertise. I thank you for listening and watching. And we'll be back on Wednesday. It'll be a detailed briefing, and we'll be able to tell you what, if any, changes we're recommending or making as a result of the CCA meeting tomorrow. Thank you all indeed very much.